Remember, when you're using long, you're starting with probes together and we're stretching and pulling apart. You can do anywhere from 5 to 10 passes, and you're just going to gradually move it over. So you're covering that frontalis. We're asking it to lengthen or to relax. Remember, this is your Botox effect. And it's very different to use the single probes, but you can still do the same movements as you would with the metal. 5 to 10 passes, that's the frontalis. Now we're going to work on the procerus and the corrugator. So there's two movements. Starting with the probes together, I'm stretching and pulling apart. We're asking this corrugator to relax. This is where people get those 11 lines. And then we're also going to do a second move, which is on the procerus, and it's a vertical move. Remember, you're always dipping your probes to get them wet. You want to make sure they're nice and moist if they start to feel dry. Your next area that you're going to work on are where the crow's feet are. This is the side of the orbicularis oculi. And we're stretching and pulling apart. And then the next area we're going to work on is the upper lip, where we hold the probes together and you're stretching and pulling apart. If there's lip lines underneath, you can do the same movement there. And then we're going to work on the mentalis and the depressor labii inferioris on the chin. Holding one, you can stretch apart, but I still find it's better to hold one and stretch away from it. Five to 10 passes, I'm moving it over. I'm going to isolate that depressor labii inferioris. And that's what we're using long on. This is relaxing that muscle. Now I'm going to switch to short. And you can choose level 1, or if you have a client who has more neck tissue, you can go up to like 400. But remember, you're always dipping the cotton tips to get them keep them moist. And now that we're lifting, I'm going to go underneath the jawline. I'm going to start at the base of the neck, and I'm going to bring it up, and I'm going to pinch and hold. What you will find is that the pinch and hold is a lot easier to do with the cotton tips. Can really grab and pinch and hold. And I'm going to do 3 movements, and then I'm going to move it over. And we're working on the platysma, so don't be afraid to get in here and really pinch and hold, or asking it to tighten. I'm going to move it over again. So you will find with your single probes, you might have to do a few more movements to cover that whole area. Holding each movement 5 times, or I'm sorry, for 5 seconds. And remember, you stay away from the trachea, but you can come to the side of it. And then the platysma comes up and it wraps around the jawline. So I had a probe underneath the jawline. Now I'm going to come above and I'm going to grab from underneath, and I'm going to really get in there and pinch and hold. I'm still conducting, so my cotton tips are nice, are still moist. That's what you have to be looking for. Now it starts blinking. I'm going to dip, and it's solid again. And don't be afraid to really get in there and pinch and hold. I'm doing the same. All across the jawline. And then you have your depressor anguli that is right here, anguli oris, and it's right here by the mouth. So I'm going to hold one probe on the top of the lip. I'm going to grab from that muscle and I'm going to bring it up and pinch and hold, asking that depressor anguli oris to tighten. There's a second move we're going to do on that same muscle group. I'm going to bring my probe up a little higher and I'm going to grab that muscle and I'm bringing it up a little bit more. You'll really be able to feel that pinch with the single probes much better. And I want to also show you a move that you can do on the lip area. Much easier to do this move with cotton tip probes. You can get a lip lift by putting the probes on the upper lip, kind of turning it up and pinching and holding. I hope you can see that. I'm actually getting on the lip and I'm bringing it up and I'm giving a lift to the lip. And you can do each movement 3 times. And then from there, I'm going to work on, we have the levator labii superioris. It runs by the nose and it's attached to the upper lip. So you're going to hold one by the orbital bone, come to that top lip, and you're really able to pinch and pull that up. And bringing that up and pinch and hold. Remember, you're doing it 3 times. Holding for 5 seconds. Then I'm going to move it over. We have the levator labii superioris, which is next to it. Bringing it up, and we're pinching and holding. And I'm going to move it over one more time. And we're bringing that up and pinching and holding. Now I'm going to dip my probes in again. I want to make sure they're nice and moist. You have the restoraceus muscle that runs right here by the side of the mouth, and you can really get in here and pinch and hold that. Nice thing about the cotton tips is they make it so that the pinch, when you're pinching and isolating that muscle, you can really get in there. And then we have the other 2 muscles. Now mind you, you can turn the intensity up on this thicker area of the face. You can turn the intensity up because these are the larger muscles of the face. Anytime you're done with the jawline, you can turn your intensity up. Now we've done the restoraceus. Now I'm going to come and we're going to do the zygomaticus major. And you can see how I can really get in there and pinch and hold. And then I'm going to do one more pinch and hold. And you can really get in here. I feel like you get a really good lift with these cotton tips because they're small. And the nice thing is you don't need to use gel. I'm going to dip them. And now we're going to work up to the forehead. You're going to do the front of the eyebrow area. I said the forehead, I meant the eyebrow. The middle. If you see any visual twitching, you need to turn your intensity down. Visual. So I do each movement 3 times. And then we're going to do a second eyebrow move. And I see twitching, which tells me I need to turn my intensity down. It's up too high. Go down to 350. And you bring it together and you lift it up. Much better. Anytime you see visual twitching, you need to turn the intensity down. I can still see a little bit. And this is an area that a lot of people, if you're going to see twitching, this is usually where I see it. So you're just bringing them together and pinching and holding. So that's using the cotton tip probes. Some of the tips I will tell you is if you're having a problem with conductivity, before you put the little cotton tips in, soak them in solution and get them nice and moist, the whole shaft before you stick them in. And then that way they'll be nice and moist. You take them out and throw them away, and then these are washed off or wiped down.